Patulong pong pahanap si Sir Ronnie. Hindi ko siya makita. Na-disconnect po siya.
Okay na. Napasok ko na si Ronnie. Ay naman. Sa dulo, sa dulo. Ayun. Ayun, kita ko na. Ang bilis
professionals. The webinar is about to start in a few minutes. Please stand by.
Derpy Hooves in the mix. Enjoy.
Dear God, thank you for allowing us today to meet and share our knowledge and time with one another in this webinar. We are truly grateful for all the blessings you have bestowed upon us. May you extend your divine wisdom to our speaker so that he would be able to impart effectively his God-given knowledge to all of us. Bless the participants as well so that they would be able to glean the vital information from this activity and spread what we've learned in the spirit of your love and generosity. May we realize that this activity should glorify your name. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiging sa sinagalan, alam ng puso, sa likid mo'y buhay. Upang pinilang, kuya ka ng magiting, sa manlulubing, di ka pasisigil, sa nagtatapulong sa simoy at sa langit mo pagaw, ay ginatapos yakaw sa pagbayang minamahal. Ang isang ang patawad mo'y magumpay ka nagkiligid, ang bituin at araw niya kailan ang kanyang ibigin. Lumanang araw ng wala.
Before we start this webinar, here are some guidelines for our virtual participants. First, please observe proper webinar and video conferencing etiquette. Also, please change your settings to active speaker view. To do this, go to the view icon of your Zoom console and swipe or select active speaker view. May we also request all participants to turn off their video feed. Do this by turning off the camera icon at the video tab of your Zoom console located at the lower left portion of your screen. You may post your questions through the link flashed in your screen. For those logged into the Zoom platform, you may post your questions through the chat box at the lower portion of your Zoom console. Details on how to get your e-certificates will be flashed at the end of the webinar. This will be open to those logged into the Zoom platform and to those viewing through our live streaming and Facebook as well. We expect your adherence to these guidelines. Thank you very much and enjoy learning online. The Biorisk Association of the Philippines together with the Philippine Association of Medical Technologists warmly welcomes everyone to this joint webinar. Let us all welcome our session moderator for this webinar. She is the incumbent treasurer of the Biorisk Association of the Philippines. Ladies and gentlemen, Miss Luella Bertuccio, RMT.
Hello, good evening everyone. Welcome to our 8th BRAP webinar. I am Luella Vertucio, the moderator for this session. To start our program, let us hear the welcome message from our BRAP President, Dr. Miguel Martin Moreno. Dr. Martin.
Magandang gabi po to all our viewers in the Philippines and hello to all our viewers around the globe. Tonight's activity, our 8th in the BRAP-PAMET Joint Webinar 2020 series, features for the second time our colleague and mentor from Sandia National Laboratories in Albuquerque, New Mexico. She will be properly introduced later. This essential topic entitled SARS-CoV-2 and COVID-19 decontamination and waste disposal is very timely during this time of pandemic. And if I may say so, a must need to know knowledge. I would like to welcome all BRAP and PAMET members who are with us tonight. I take this opportunity also to welcome the founding president of the Philippine Association for Central Sterilization Services and Management, also known as PACSISM, Ms. Melanie Ann Alcantara, accompanied by two officers, Ms. Lolita Culaba and Ms. Arnefelina Tamayo. I hope this event brings the start of a fruitful collaboration with our two associations. Last but not the least, welcome to the fast-rising viewers on our two sites on Facebook, on the BRAP Facebook group page, and on the PAMET CPD activities page. On behalf of BRAP and our official partner PAMET, I wish you all a fruitful webinar, and as the saying goes, break a leg, everyone.
Okay, thank you very much, Dr. Martin. Your welcome message inspires us to listen to BRAP webinars and future and upcoming session. And now, to give the opening remarks, let us welcome the President of PAMET, Mr. Ronaldo E. Puno. Mr. Puno.
Thank you very much, Ma'am Luella. Good evening, everyone. Good evening to all our BRAP and PAMET members, and welcome to the 8th joint webinar of BRAP and PAMET. So as we continue to fight COVID-19, BRAP and PAMET remains to be committed in providing continuing educational opportunities to our colleagues, particularly our medical technologists, like this webinar on decontamination and waste disposal. We all know that a basic knowledge of decontamination and waste disposal is crucial for biosafety in the laboratory, especially in time of COVID-19 pandemic. And I am personally very interested in these two topics that because these are part of the sections that I handled in preparing the BRAP-PAMET Biosafety Guidance Manual. And I am particularly thankful to our invited speaker, Dr. Cecilia Williams, who is joining us as webinar speaker for the second time to discuss these two equally relevant topics. The purpose of decontamination is, of course, to prevent the spread of microorganisms and other noxious contaminants that may threaten the health of human beings or animals or even damage the environment. And with the several decontaminant methods available, physical cleaning, disinfection, and sterilization are the most commonly used during COVID-19 pandemic. On the other hand, proper waste management similarly plays a very vital role in this time of COVID-19 pandemic, which will also be given emphasis in this seminar. So we hope that through this webinar, we will be able to learn more important, useful, and effective strategies on the way we decontaminate and handle our laboratory waste. So once again, good evening, and hope everybody will learn and you enjoy the session tonight. Thank you.
Okay, thank you very much, Mr. Furno, for that heartwarming and encouraging opening remarks. Before we go to our lecture, may I remind all to mute your microphone to avoid unnecessary noise and close the video for clearer resolution. If at any time during the lecture, you need to ask a question or you need to clarify something, you may put your question in the chat box and in the link provider. And last, there will be a question and answer portion at the end of the talk. So no question, no certificate. I'm just kidding. Bigyan ko lang kayo ng kon. But be ready for that question. Moving on, let us proceed to the woman of the hour. Let me introduce our speaker for this session. Our speaker is a very good friend of our association and is well known here in the Philippines in biosafety and biosafety group. She is one of our favorite lecturers, and I know she enjoys being with us. She is a principal member of the technical staff in the Global Chemical and Biological Security, or the GCBS group at Sandia National Laboratories. Over her 38-year career of Sandia, she has worked as a principal investigator and a diverse technical portfolio. Currently, she leads the group's biorisk engagements initiatives in the Philippines, as well as the biorisk and chemical security initiatives in India. She has Masters of Science degrees in Organic Chemistry and Igneous Geology from the University of New Mexico. She earned her PhD from Texas A&M University, researching the interaction of a rotavirus non-structural protein enterotoxin with cellular caveolin. Ladies and gentlemen, let us all hear from Dr. Cecilia V. Williams.
Okay.
Hi, Doctora. How are you?
Hello, how are you? Okay, I'm going to share my screen now. Let me find my, oh geez. I don't, I'm going to have trouble here. I don't see my, hold on. I think I found what I'm looking for. Okay. Okay. Materials. Can you see my screen?
You're okay. You're okay.
Yeah, yes.
Okay, you see the presentation. Okay, good.
There you go.
There we go. So I want to thank BRAP and PAMET for inviting me again to be a speaker on your webinar series during the SARS-CoV-2 COVID-19 pandemic. We are all working to
Cecilia,
get through. Yes? Hello?
can you use your slideshow because we're seeing your notes?
Ah,
We're
I
seeing-
have,
we're using-
okay, hold on.
Pagpapalit ka rin yun.
Just a second. And slideshow.
You can
And
click the use slideshow. Yeah.
pardon? Just a second. Let me slideshow. So I don't know why it's showing
Play from
that.
the start. You can go to play from the start, the one at the leftmost part.
Let me go down here. Are you still seeing the notes?
Yes. Click the use slideshow there.
Okay. Okay. Let me stop share and start the slideshow over here, and then I will share. Okay.
Byron, okay siya.
Okay. 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 Let me go back to share screen. I think I have it. Okay.
Ganun pa rin eh.
Oh, it went back to the same thing. Use slideshow. Now do you see it?
Yes.
Perfect.
All right. Sorry about that, folks. Sometimes it gets stuck in presenter view. Okay, let's start again. So we are all working to get through this pandemic, and we have many challenges in our workplace as well as in our homes. This evening, we're going to talk about decontamination as well as waste disposal. I'm going to turn my fan on. It's a little warm in my office. So let's start with decontamination. So first, I want to remind you that it's very important to perform a continuous risk assessment. And what we are providing you today is provided to inform individual and organizational risk assessment and risk-based biosafety and biosecurity decisions. We have attempted to provide you with the most current information we have at the time. However, please remember that what we know and don't know is constantly changing. So you should daily take a look at what is known and what is not known, and use that information in order to decide how you work safely and securely. We as organizations and individuals should be willing to change procedures based upon new information. Let me caution you, though, that there is a lot of misinformation circulating. So when you're looking at new information to inform your risk assessment, please consider the source of the information. Also remember that biosecurity is also important, but biosafety is paramount. So with this module, our objectives are to have you know the processes that are known or anticipated to be effective in removing or reducing infectious SARS-CoV-2 from surfaces and hands. We want you to feel confident that the information you are receiving is current, relevant, and has been reviewed by trusted subject matter experts. We also want you to be able to use this information we provide to inform your local decisions on biorisk management when working with or encountering SARS-CoV-2 in the laboratory or even in our homes and environments. This next slide focuses on the hazard profile of SARS-CoV-2, and I'm sure you all know most of the known characteristics. SARS-CoV-2 causes COVID-19. It is an envelope virus of 500 to 200 nanometers, 50 to 200 nanometers in diameter. Its primary route of infection is a mucous membrane exposure to infectious droplets from infected persons or even contaminated surfaces. We also know that it can be stable up to 3 days on plastic and stainless steel and much less stable on copper and cardboard. Since it is an envelope virus, it is effectively inactivated by soap and disinfectants. We also know that humans are highly susceptible, and there is currently no treatment. However, there are many treatments being evaluated, and also there are many vaccines being evaluated and are going through testing. On the right-hand side, we have a list of characteristics that are still under investigation. There is still question as to whether there is asymptomatic transmission. They are still looking into the role of aerosols and small droplets. I've seen some reports that say there is transmission via aerosols, and then there's other reports that said, no, there isn't. So this is still under question. We still don't know the infective dose, and we don't know the length of infectious viral shedding. And we don't have a good understanding of immunity after infection. So this slide just gives us some information on SARS-CoV-2 stability on environmental surfaces and laboratory samples. On the right-hand side, we have data from the New England Journal of Medicine and Lancet. They indicate that SARS-CoV-2 can be stable on plastics somewhere between 3 and 7 days. On stainless steel, similarly, 3 and 7 days. However, on cardboard, on copper, less than 4 hours. On cardboard, less than 24 hours. And then paper, less than 3 hours. On wood or cloth, maybe about 2 days. On glass, up to 4 days. So this virus has varying stability depending upon the surfaces. On the right-hand side, we have the viral stability in different laboratory samples like feces and urine, 1 to 2 days, diarrhea, up to 4 days. In cell culture, depending upon the temperature, it can be stable up to 21 days at -80 degrees or about 5 minutes at 70 degrees C. On the bottom part here, we have the viral load in clinical samples, and it varies from about 8 times 10 to the 4 to 7.5 times 10 to the 5, depending the type of sample. Okay. Okay, the next thing I'm going to do before we actually get into discussing decontamination methods is run through some terminology to make sure that we're all on the same page. First of all, as Ronnie said, decontamination is a general term that refers to the process of making an item safe to handle. For microbial contamination, this means reducing the contamination to where the risk of transmission is minimized or even eliminated. Some of the processes that fall under decontamination include sterilization, disinfection, and cleaning methods. Let's talk first about sterilization. Sterilization renders an item completely free of living microorganisms, viruses, even spores. This means if something is sterilized, there's no living organism on it. So something is either sterile or it's not sterile. There's no in between. Sterilization is very important for things like medical instrumentation, working with laboratory media, and it's also important in decontamination for waste disposal. Oops, I'm sorry. So let's now talk about disinfection. Disinfection refers to a less rigorous process than sterilization, and it's a process that kills most microbes on surfaces. And we refer to terms like high, medium, and low, depending upon the type and amount of microbes that are killed. We say something has a high disinfection capability when it kills vegetative microbes and inactivates viruses, but not spores. We say it's medium when it kills vegetative microbes and inactivates most viruses. And then it's low when it kills most vegetative microorganisms except and tuberculosis, and inactivates some viruses. And typically we call these sanitizers. So now we're going to talk about types of microbial decontamination. As you can see from this slide, there are several types that range from chemical, thermal, irradiation, temporal, and mechanical. And so I'm going to start with mechanical. And under mechanical, we have cleaning, and cleaning with soap and water. This is a mechanical process. And using the soap is a very important part because there are surfactants in your soap. And so the surfactants and the friction of rubbing will help lift the particles off your surfaces or off your hands, and the water then washes away the particles. So it's a combination of the mechanical process of rubbing and the use of the surfactant that helps remove the microorganism. The second in this list is filtration. And filtration is also a mechanical process that separates particles based on different sizes. I'm sure we've all heard of HEPA filters. HEPA filters relies on the different sizes of the different properties to trap particles. And a HEPA filter will trap particles greater or less than 0.3 microns at a 99% efficiency. Microns, particles the size of 0.3 microns in size most likely pass through the HEPA filter. We also use filtration in using cell culture media when we have to sterilize our cell culture media. The second one in our list is temporal. Temporal is simply time. oftentimes, if we just leave an area that's been contaminated, if we leave it alone and wait, we know that the microbes are not stable indefinitely. And so if we leave the surfaces or the item undisturbed over a period of time, the surface or item will become safe to use. And this is especially true if we know the time frame of the expected loss of viability on a particular surface. However, using time is not really viable if surfaces are constantly used, or if a piece of equipment is constantly used and we are continually touching it. So temporal might be used, for example, if you have an expensive piece of equipment that you can't use soap and water or some kind of chemical disinfectant to clean it, you might cover it and leave it for a period of time and wait for inactivation to occur. Then we have chemical decontamination, and this is one method that most of us are familiar with. And you can see that there are many classes of liquid chemical decontaminants, ranging from alcohols, aldehydes, phenols, chlorines, acids, quaternary ammonium. And most of us are familiar with alcohols and chlorine. We also, on the chemical side, we have gas and vapors, hydrogen peroxide, chlorine dioxide, and formaldehyde. And these chemical decontamination methods have varying effectiveness on different types of microorganisms. The next decontamination method we have is thermal. And I'm sure you're all familiar with thermal. All of us are familiar with autoclaves, where we use a combination of steam and pressure to sterilize. And we use this to sterilize medical equipment and some media. And of course, we use the autoclave to decontaminate or sterilize our laboratory waste. We can also use steam, dry heat, and boiling water to decontaminate. So we can often put an item in a dry oven to decontaminate it. And the last area is irradiation. And we may be familiar with some radiation, especially in biosafety cabinets where we have UV light to decontaminate the surfaces. There are other technologies that use microwaves and gamma rays. For example, microwaves are often used to treat shredded or infectious waste. So there are a number of ways that we can decontaminate. And let me emphasize, mechanical cleaning with soap and water is very important when decontaminating yourself and your hands. This is the one best way to protect yourself. Wash your hands, wash your hands, wash your hands. And then most of us use chemical or thermal methods to decontaminate. Let's talk a little bit about factors that influence the decontamination of microbes. So microbes have a varying susceptibility to decontamination. Some microbes are least susceptible. For example, bacterial spores are very hardy, and they're not as susceptible as any of these other microorganisms as we go down the list to Coccidia or Mycobacterium, non-envelope viruses, fungi. And at this very bottom, we see enveloped viruses. And they are the most susceptible, which fortunately for us, SARS-CoV-2 is an envelope virus, so it is very susceptible. Another thing we should consider when we're talking about the microorganism, besides type, is the concentration. If you have a high microbial load, then it will take longer to effectively decontaminate. The next thing that influences decontamination is the method. So it's important to consider contact time, because you may need a longer contact time if you have a higher microbial load. Also, you have to consider that some methods of decontaminating may not allow for the contact time that's required. For example, isopropyl alcohol is a volatile chemical, and it may be that the contact time required for a high level of disinfection may be longer than the alcohol will stay around. And so you have to be sure that you have an application method that will allow for sufficient contact time. So your application method may be spraying or wiping or soaking, or if you're using vapor or gas. So contact time is very important. Contact time, along with the microbial load and method of application, as well as the rate of application, are to be considered. And the final thing you should consider is the age and storage of your chemical disinfectant. As the chemical disinfectant is stored, it may become less effective. For example, bleach becomes less effective as it sits around in your laboratory. So you should remake your bleach solutions often. The next factor that influences decontamination is the environment. And we need to look at the types of surfaces. Are the surfaces flat or uneven, or are they porous? So if something is flat and non-porous, it's easier to decontaminate. If something is porous, it's very difficult to decontaminate. And think about trying to decontaminate in a biosafety cabinet, and where you have corners and edges. Oftentimes those are harder to decontaminate than just a simple surface. The other thing you need to consider is the presence of other things on your surfaces, such as organic material or grease, oils or biofilms. These all may have the effect of inactivating or impeding the effectiveness of your decontamination chemical. Also, too, you need to take a look at UV light decontamination. If you're decontaminating your biosafety cabinet and there's dust on the surface, the UV light may not be able to reach the surface, as well as the UV light may not necessarily go around the corners or get all the edges. Another thing you need to consider is temperature and relative humidity. Both of these affect the stability of the microbe and the decontaminant. pH is also another thing you should consider. The pH, or the hardness of the water you use to dilute your chemical disinfectant, could impact its effectiveness. And it's imperative that you prepare your surfaces properly for decontamination, and you prepare your chemical disinfectants by the manufacturer's specifications, so you can duplicate the effectiveness that the manufacturer associates with their product. So now we're going to talk about SARS-CoV-2 after exposure to decontamination methods. So it's been found that SARS-CoV-2 is undetectable in less than or equal to 5 minutes when using hand soap. Over here, when we take a look at the chemical disinfectants, SARS-CoV-2 is undetectable in less than 5 minutes using household bleach, iodine, chlorozionol, chlorhexadiene. All of these in less than 5 minutes is undetectable. Sorry about that. Remember, SARS-CoV-2 is an envelope virus, and so it is easily to destroy the envelope. And when you destroy the envelope, you effectively inactivate the virus. We do know, however, that SARS-CoV-2 can be stable on some surfaces for more than 60 minutes across a wide range of pH and at room temperature. Using thermal methods, we know that at 4 degrees, it's undetectable in about 14 days. 22 degrees, around 7 days. 37 degrees, 2 days. 56 degrees, 30 minutes. And 70 degrees, around 5 minutes. And so using even like thermal dry heat to decontaminate, putting items in a drying oven that's at least 70 degrees for more than 5 minutes will effectively decontaminate for SARS-CoV-2. So let's take a look at surfaces and decontaminating equipment. So when decontaminating surfaces, it's imperative that you use disinfectants that have proven activity against envelope viruses. And you can go to the web and look up US EPA, and there's a list called the N list that'll give you a list of disinfectants and their activity against different microorganisms. For SARS-CoV-2, we can use bleach or sodium hypochlorite, 1,000 parts per million. We can use ethanol, 62 to 71% ethanol, hydrogen peroxide, 5%, and quaternary ammonium compounds. Again, you should pay attention not only to the selection of your disinfectant, but also the contact time and the dilution and the expiration date of your working solution. Remember that things like your bleach solution degrade quickly over time. Let's talk about equipment. Disinfection of equipment should be done in the manner that the manufacturer recommends in order to have continued functioning and integrity of the material in the equipment. You may use some of the same disinfectants that you use on laboratory surfaces, depending upon the recommendation of the manufacturer. Also, you may be able to use thermal decontamination, such as dry heat or even autoclave or boiling, depending upon the piece of equipment. And again, as I mentioned earlier, if a piece of equipment is not amenable to decontaminating with heat or with a chemical disinfectant, you can use time. You can cover the piece of equipment and put a sign that it's out of service and wait for a period of time for decontamination. As I'm going to back up a slide. As you recall that in between 22 degrees and 37 degrees, you can leave a piece of equipment up to between 2 and 7 days, and it will essentially become safe to use after that period of time. So the last thing I want to talk about is hand washing. For personal safety, hand washing is one of the most important things that we can do. Laboratory personnel need to wash their hands after removing their gloves when they've been working with infectious agents and before leaving the laboratory. And understanding that the stability of a SARS-CoV-2 varies on different surfaces. If surfaces haven't been decontaminated and you cannot tell by looking, it's very important that if you've touched a surface, wash your hands before leaving the laboratory. That way, if you touch your face or your eyes or your nose, which we all do, you won't contaminate yourself. So it's very important to use soap and water washing for at least 20 seconds. And just plain soap and water is as effective as antibacterial soaps. And remember, it's the mechanical process of the rubbing and the surfactant in the soap that helps lift the viral particles off your hands and are washed away with the water. Oftentimes, though, soap and water is not available, and you can use alcohol-based sanitizers with at least 60% alcohol. So using a hand sanitizer is a chemical method of disinfection, and the sanitizing agent will be effective by the same factors that influence other disinfectants. So if your hands are dirty and greasy, your hand sanitizer may not be effective on first use. You may have to use a couple of them. But whenever possible, as soon as soap and water are available, you should wash your hands with soap and water. Here I have a list of references that have been used in putting this presentation together. And I will make this available to Martin, and Martin can make this available to anyone who would like it. So now we are going to, let's see, I'm going to stop sharing my screen so I can get to my other presentation. Let's see. Oops. Okay. Just a second. I've got to find it. Okay, here we go. Well, I can't open it back up. There we go. Okay, getting back to sharing screen, and here we go. Sorry, I'm a little Zoom.
Good morning, good afternoon, and good evening, everyone. Welcome to the Global ICT webinar series. We've had a little bit of a break, but we are back.
Hold on, I have some background noise. Okay, sorry about that. I had some technical difficulty. I'm going to do you see my screen?
You're on presenter's view again.
Okay, presenter's view again. Let me go up here, use slideshow. Am I on slideshow now?
There you go.
Okay, there we go. So now we're going to go from decontamination to laboratory waste disposal. And I'm going to remind you that you should do a continuous risk assessment when you are preparing your laboratory waste disposal methodology, mainly because what we know about SARS-CoV-2 is changing rapidly. So for this module, we would like you to know the processes of collecting, disposing, and treating laboratory waste, including the processes that are known or anticipated to be effective in removing or reducing infectious SARS-CoV-2 waste. We want you to feel confident that you are receiving current and relevant information and it's been reviewed by trusted matter SME. I'm going to have to stop a minute and get a Kleenex. I'll be right back. Thank you for your patience. We also want you to be able to use this information to make your decisions on waste disposal and biorisk management when working with or encountering the SARS-CoV-2 in your laboratory. Okay. So I'm going to skip this slide because we've already talked about the hazard profile. So, oh, I have a picture missing. The categories of biological waste include solids, sharps, pathological waste, mixed waste, and liquid waste. So solid waste includes laboratory plasticware, disposable PPE, wipes, stool samples, animal cage, and bedding. Sharps includes anything that has a point or an edge. Pathological waste includes samples of human or animal organs or tissues. Of course, liquid waste are your aspirants, clinical or bodily fluids. And then mixed waste is mixed biological and chemical waste. For some reason, my slideshow is missing some of my pictures. I apologize. So the steps of waste management include segregation, collection, storage, transport, treatment, and disposal. You should look at these steps and make sure that your laboratory waste management includes all of these steps. remember that waste disposal from COVID-19 patients should be handled as just as other biohazardous waste in your laboratory. It doesn't need any special treatment or additional packaging or disinfection procedures. And remember that the volume of infectious waste during the COVID-19 outbreak is expected to increase. So it's important that you increase your capacity for handling and treatment of healthcare waste. So let's talk about the different steps in laboratory waste disposal. Segregation and collection go hand in hand. You should segregate your sharps from your from your pathological waste. You should segregate it from your solid waste and your mixed waste. And so each type of waste should be segregated and put into some type of designated container or bag. It should be leak resistant and should contain the waste so that it is not spilled or there's not an accident in your laboratory. For example, if you have liquid waste, you should be sure you put your liquid waste in a container that is leak proof. You should also store this medical waste in labeled leak-proof containers, especially if they have foul odor. Facilities should dispose of the waste regularly, and your area should be well ventilated and away from pests, the area where you store this, where you store your waste. Remember, biosafety and biosecurity incidents often occur as the result of improper handling and storage or incompleteness of waste. So you segregate and collect your waste. You store it in an area that is safe and away from pests and non-laboratory personnel. Then the next step is treatment and final disposal. Oftentimes laboratories will conduct treatment in their facility. For example, you may take your waste to autoclaving and autoclave it prior to final disposal. So COVID waste need not be rendered sterile, and the treatment processes may include autoclaving, incineration, interment, chemical disinfection, grinding methods, or other disinfection and encapsulating methods. So remember, microbiological waste has the greatest potential for infectious disease transmission. So ideally, you should consider on-site decontamination, such as autoclaving, incineration, prior to final disposal. And of course, final disposal is to remove the waste from contact from the general public. All those who handle healthcare waste, of course, should wear appropriate PPE and should perform hand hygiene upon removal of that PPE. And remember, that PPE is then considered laboratory waste and should be disposed of properly. Some other considerations we should look at is, do you encounter waste from medical emergencies? If there are waste from the medical emergencies, you should follow standard operating procedures for containment and disposal of used PPE and regulated medical waste. I don't know if any of you encounter bodies of persons who have died from, are known or suspected of dying from COVID-19, or if any of you do autopsies. But for autopsies, following an autopsy, you should follow standard operating procedures for containment and disposal of used PPE and regulated medical waste. You should certainly use tongs to dispose of this medical waste to prevent personal contact. Disposal of human tissue should be done according to routine procedures for pathological waste. And of course, after a body has been bagged, the outside should be disinfected, and when you're disinfecting it, you should wear disposable gloves. There is no evidence of persons having become infected from exposure to bodies of persons who've died from COVID-19. Another important thing is people attending a body should ensure they wear appropriate PPE and hand hygiene, and a body should be wrapped for transport, and direct human contact should be minimized. One thing we have to consider is the dignity of the dead and their families, which should be protected. Embalming is not recommended, and friends and families may want to view the body, and so we should discourage any touching or kissing of the body. Oftentimes this is a practice in some cultures. Thorough hand washing with soap and water should be done after viewing. And of course, you should abide by all national and local regulations for viewing and disposal of remains. Other points you should consider for your waste treatment is waste treatment options must rely on local requirements. Also, we must remember we have cradle to grave responsibility. And so that includes on-site treatment, off-site treatment, and disposal. All who handle healthcare waste should wear appropriate PPE. And remember, the categories of waste need to be managed by the different types of waste. Sharps pose the greatest risk of injury. So we must take particular care in handling sharps. All facilities should have a waste management plan that complies with local requirements. Also, too, when using your autoclaves or your incinerators for your sterilization or decontamination, you should ensure they are used properly and that their upkeep and operation is correct to reduce risk to laboratory workers and to the environment. And remember to perform a risk assessment when updating your waste disposal plan. Okay. In summary, the waste from SARS-CoV-2 should be considered as other biohazardous waste in your laboratory. You need to consider the following steps in preparing your waste management plans: segregation, collection, storage, transport, treatment, and final disposal. All healthcare workers who handle healthcare waste and bodies of confirmed or suspected COVID-19 cases should wear appropriate PPE and always perform proper hand hygiene after removal of your PPE. Remember, you are responsible for all on-site and off-site waste treatment and disposal. And again, remember, information surrounding COVID-19 is constantly changing and there is much information. Be prepared to evaluate the new information and conduct a risk assessment as new information becomes available. Because all of our goal is to keep ourselves safe and healthy during this pandemic. And again, here are some references and resources. And I will provide this to Martin and he can share it with anyone who has requested it. And I apologize for my a few technical difficulties and especially my slideshow that for some reason wasn't showing my figures. And with that, I will take any questions you might have.
Okay, thank you, Dr. Cecilia, for that very informative lecture. And we are truly appreciate having you as one of our speakers here. Moving on, we will now open the floor for the question and answer portion. First, I will read a question from the chat box, and those of you who would like to ask the question yourself, please point your cursor to the raised hand and I will call your name. Okay, we have several questions here in the chat box. Dr. Cecilia, the first question is from Raymer Sana po. Can you hear me, Dr. Cecilia?
Yes, I hear you.
Okay. How can we or how to validate record form of waste decontamination using physical, chemical, and or biological indicator? How can we or validate and how to validate the record form?
So how to validate that you have successfully decontaminated something or a surface? Is that the question?
Yeah, yes, a record form of waste decontamination using the physical and chemical record form.
I don't understand what you're saying, what you mean by record form, but you can you can always validate the whether or not you have successfully decontaminated a surface by taking a swab and culturing it. Or there's such a thing as a Rodak plate where you actually touch the surface and you incubate it, and if something grows on it, but you're specifically looking for SARS-CoV-2. And so I would swab the surfaces and use whatever method you have developed for identifying SARS-CoV-2. What you might want to do, you don't want to propagate the virus. So you might want to use PCR to determine if in fact SARS-CoV-2 is still present. Does that answer the question?
Okay, I hope. I hope Mr. Raymer Sana po accepted your answer.
I think that's what he was asking. You know, besides SARS-CoV-2, of course, there may be other microbial contamination. So swabbing the surface and just culturing it will get you the other microbes. But for the virus, I would I would try PCR
Mhm.
of the sample that you take.
Okay, thank you, Dr. Cecilia. Second question is, what is your recommended retention period for swab samples, and how long should you store a swab sample before disposing it?
First of all, I suggest that you check your laboratory procedure on what the recommended retention time is for a swab. I can't tell you how long you should retain it. You should have a laboratory procedure that tells you how long to retain it. For example, I worked in an Ebola lab during the outbreak, and we had many swab samples, and we would take the swab samples and we would, of course, inactivate them and collect the RNA, DNA material, and we would run our test on the actual samples. Once we had collected what we needed, we destroyed the samples. Our guideline was not to retain the samples. So the retention time that you keep your samples should be something designated by your facility or by your public health department or the Philippine public health department. I can't tell you how long to do that.
Okay. Okay. Thanks. Next question is it possible to disinfect or decontaminate the N95 respirator? If so, what are the processes are effective?
N95 respirators are designed for single use. However, in this current environment, it is often, you don't often have a supply. There have been some methods that have been developed to decontaminate them. However, I don't have those methods off the top of my head. I do have a document that I can forward to Doc Martin, and he can forward it to whoever wants it. But typically, N95s, if you have a sufficient supply, they should be single use.
Okay. Okay. Next is, in disinfection, it is safe to use a UV light lamp for disinfection purposes at home. Do you recommend the UV light at home as disinfectant? The UV light?
I personally wouldn't spend the money to buy a UV light. SARS-CoV-2 is an envelope virus. Envelope viruses are easily decontaminated with alcohol and chlorine. Alcohol essentially disinfects, actually dries out the envelope. It sucks the water out of it, and the chlorine essentially pokes holes in it. Alcohol and chlorine are extremely effective. That's what I would use.
Okay.
And as I mentioned, soap and water is good.
Good.
You could also use your kitchen dish soap or hand soap. So there are a number of things. I wouldn't spend the money to purchase light.
Okay, thank you very much. Okay, doctor, can you give insight about the use of spray bottles as method of applying disinfectant while working inside the biosafety cabinet? CDC strongly recommends against using it, but the WHO allows it. Can you give the insight for this?
Okay, a spray bottle, and what are you spraying is my first question. If you have a biosafety cabinet and you have And a stainless steel, if you're using alcohol, that's very harsh on your stainless steel. What you have to remember, even in a biosafety cabinet, if you're spraying, the spray has the possibility of spreading the contaminant. So if I were spraying a surface in a biosafety cabinet, I would put down an absorbent material and spray the material and let that set on the surfaces. On the side walls, I would wipe, of course, using the appropriate PPE, the appropriate gloves, because you have to be careful when you're spraying, even though you have a sash, that some of that spray doesn't come back on you. And if there's a contaminant, does the spray pick up the contaminant? And so I would, like I said, on the walls and the sides, I would use wiping. And if you want to spray on the work surface itself, put down some absorbent material. And actually, you should always put down absorbent material when you're cleaning up a spill. You should never spray directly on a spill, because when you spray on a spill, you spread it out. But if you put the absorbent material over it, you contain it.
Okay. Okay, thank you. There is a question here that, is there a study wherein salt water can destroy the COVID-19 for a certain time to explore? I didn't understand the salt water. So salt water.
Yeah, salt. I have not seen any studies on salt water specifically. However, if you recall, when we were talking about the stability of SARS-CoV-2, it is stable over a wide range of pH. And so salt water itself may not decontaminate. I have not seen any studies.
Okay, thank you. Then can a person have immunity if he had already infected with COVID virus?
That is something that has not been established. That is one of the things when, I was talking about the hazard profile, is they're still trying to determine whether a person develops immunity based upon the infection, a previous infection. There has been some studies done on the T cells that might be involved in immunity, but there's no definitive answer at this time.
Okay, next question. Do you recommend Lysol disinfectants? Can Lysol disinfectants, do you recommend for this? Lysol.
Yes, Lysol. I understand Lysol. I would read the manufacturer's recommendation on the uses of Lysol. I'm not sure what is in Lysol. I don't use Lysol, so I don't know specifically what's in it, but I'm sure it's a disinfectant that has one of the chemical groups that we have listed. And so I suggest, if you want to use Lysol, go to the internet, Google Lysol, find out what the manufacturer recommends, and find out what the ingredients are. And if it's one of the chemical disinfectants that are common, we know that we're dealing with an envelope virus, and envelope viruses are easily decontaminated. And again, I go back to bleach and alcohol. Those are the things to use.
Okay, thank you. There's a question here, I think, very simple question. If in case the virus also stay in leather materials like shoes and bags, What is the best disinfection for that?
Shoes and bags.
Yeah.
What kind of bags? Like grocery bags or
The
something?
grocery bags, any kind of bags.
Any kind of bag. Okay.
Yeah.
Well, I know that I have some very nice running shoes that if they were contaminated, I would throw them in the washing machine. However, I have some very nice leather shoes that I wouldn't want to do that with. And I may not want to decontaminate them with any kind of chemical decontaminant. And I would have to consider, well, can I wash them with soap and water? Remember, we said soap and water is very effective.
Yeah.
But alternatively, if you don't want to wash the bags or you don't want to use any kind of chemical disinfectant, remember, time is a good method of disinfection. And we know that between 22 and 37 degrees, the SARS-CoV-2 lasts from 2 to 7 days. So I would put them in an area, cover them, and leave them for at least a week. And then they would probably be safe to use. So soap and water, if they can go through soap and water, chemical disinfectant, if you want to use that on your bags or your shoes, or just time. So you have 3 options.
Okay. If you didn't have a decontamination like the shoes, how long does the virus stay in the leather materials, like the shoes and bags, etc.? How long the virus stay?
I haven't specifically looked at leather, but cloth, as I recall, it was 3 or 4 days. But so what you just put them aside. You know, if you want to be really safe, I would put them aside for 2 weeks, and then I think you would be fine.
Okay. How should we disinfect face shields made of plastic if it is required to be worn out outside? It is required because
How should we disinfect?
How should we disinfect? Face shields that made of plastic.
Something made of plastic. I don't know what word you're saying. I hear patient, and it. Can you spell it for me?
These face shields. Face shields.
Face shields. Okay, face shields.
Yeah. I think soap and water.
Soap and water. Wash them.
Yeah.
And wash them frequently, because you're wearing the face shields and you're breathing in and out. I would use, soap and water. I would not use any kind of chemical. And you should, when you wear a face shield, you should wear a face shield that is multi-layered, or a surgical mask is fine.
Okay. Thank you. I think this is the last question, or maybe the second to the last. Some establishments here, they'll use 70% isopropyl alcohol to maximize their use and supply, but it will still be effective? I don't think so. That is effective, right?
No, always you do not use alcohol at 100%. You don't use alcohol at 100% because of its vapor pressure. It evaporates very quickly. So you should always, and even what I recommended earlier was 60 to 70% alcohol. 70% alcohol with a sufficient contact time is best. And the reason is that with the water and the alcohol, it lowers the vapor pressure and allows the alcohol to stay on the surface longer without evaporating.
Okay, this is my last question, I think. When is it appropriate to transport or confirm SARS-CoV specimens by pneumatic tube? what is the appropriate to transport on confirmed SARS-CoV specimen by using pneumatic tube?
Okay, so you're transporting patient specimens, say within the hospital
Yeah.
to the
Yes.
laboratory by pneumatic tube.
Yes. When
Okay.
it is approved.
So again, that is a decision or guidance I can't give. The hospital or the health department must have guidance that each facility must follow. Now, when you put a specimen in a pneumatic tube, I'm sure you just don't take the specimen and put it in a tube. You may put it in another container.
Okay.
Tube. But I would follow the guidelines of the facility. And let me remind you that SARS-CoV-2 is no different than any other biohazard. And especially since it's an envelope virus, it doesn't need any special treatment. Use the procedures you have in place for handling, treating, and disposing any biological material.
Okay. Thank you very much, Dr. Cecilia. Then due to lack of time, we have to put an end to our question and answer. Thank you for your participation, viewers, and that was a very lively interaction. I hope that you were clarified by the answers from our very good speaker. Once again, thank you, Dr. Cecilia Williams.
Yes, and I apologize for my technical difficulty. I was just having trouble with my computer. I apologize.
It's okay, no problem. Thank you once again.
Thank you very much.
Okay, moving on for a brief summary of Dr. Cecilia Williams' talk. There were two presentations in her talk. The first part is about decontamination. The objective of this first lecture were to know processes known or anticipated to be effective in removing or reducing infectious SARS-CoV-2 from surfaces, hands, and etc. Then, to feel confident that information received is current and relevant, and to be able to use this information provided to inform local decisions on biorisk management when working with or encountering SARS-CoV-2 in the laboratory. And last, proper hand washing had been discussed as one of the best ways to protect ourselves. Then, the second part of the lecture is about the laboratory waste disposal. What are the objectives? Is to know the processes for collecting, disposing, and treating laboratory waste, including processes known or anticipated to be effective in removing or reducing infectious SARS-CoV-2 waste. Third, to feel confident that the information received is current, relevant, and has been reviewed by authorities. And last, to be able to use the information provided to inform local decisions on waste disposal and biorisk management when working with or encountering SARS-CoV-2 in the laboratory. Once again, thank you very much. I hope everyone learned a lot from these two modules presented by our speaker tonight. Thank you very much for your attendance and very active participation. Okay, thank you once again. And how to get your e-certificate or how to claim your e-certificates? Answer the webinar post-evaluation and post-test using the link to be flashed in the succeeding slide. Double check your email address and full name before submitting your post-test. You need to garner at least 60% score in the post-test to merit an e-certificate with a single attempt. The e-certificate will be sent to your registered email within 10 working days after the webinar. Okay, ladies and gentlemen, thank you very much again and have a good day. See you again. Marami pong salamat. Once again, releasing of your certificate within 10 working days.
Derpy Hooves in the mix. Enjoy. soul in the mix.
wonderful